good morning and welcome to DatelineAbuja on AIT. Well, medical tourism is something that we should look deep into. People travel out of the country to seek medical treatments for liver problems, kidney problems, to give birth, the ENTs. And when they do that, they are actually abandoning the local sector. So that's why today we'll be looking into medical tourism. Well, medical tourism is the movement of people from one country to another just to seek medical treatment. An estimated $1 billion have been spent on medical tourism, boosting the health sector abroad whilst abandoning the local sector here in Nigeria. The real question is it that people have lack of faith in our health sector, or they just want to spend their monies? DatelineAbuja went into the street to seek the opinions from people on this very controversial topic. I'm Hauwa Momoh. Welcome.
We have doctors here, we have good hospitals here. To me, there's no point of going outside for medical treatment.
We have all the things it takes us here in Nigeria to do all those things, but people are going outside. I don't know what the governments are doing about it. They're supposed to do something about it. Why not we do it here in our country, Nigeria, to make it a better home for everybody?
Traveling abroad is a wastage because all the money they use to travel or even paying for tickets alone is money. If that kind of money is being used within the country, it will have a positive effect on our economy. And it will promote our medical practitioners. If we can hear that, like Indians, as they treated one sickness or the other, if most of these people too within the country, they do it, it will bring up the image of our country on medical terms that we are good. We have good doctors that can treat some kind of sickness, that can do it.
The government will provide all the necessary equipment so that they should have do everything here. For the transport self and everything, you see, it's do everything back. As they are saying they should patronize, just like they are saying they should patronize made in Nigerian product. But if you can see, most of them said they're even talking about that one. They're not even doing anything to show the example, you understand? So they're supposed to be their treatment here, not going to abroad.
It depends on the way you see it. Maybe if you don't have much, you won't go and waste it. To me, Nigerian hospitals are good and they are coming up and they can do better. If they will use that money they use outside to put it in Nigerian hospitals. Thank you.
A medical sector of Nigeria, they should declare a state of emergency because it makes channel for capital flight. You wonder why a lot of people seeking for a medical checkup that we can as well address our health sector here. And if we declare state of emergency in our health sector, and let's say for instance we take a time frame of 36 months, which is 3 years, for we ban every sector, every class not to go to seek for a medical outside in Nigeria, and that money that will have gone out, they use it in recuperate our health. I think we are good to go.
For me, because we don't want to grow on our own. Of recent, the statistics in one of the Dubai, the Nigerian are the people that patronize the same one medical center, and they were making billions of naira out of it. We can do all these things. It's a very simple thing. If we really serious to develop our own country, it's a very simple thing. We should copy what we have seen out there, bring it down here. Let our people patronize our own so that our own naira can be strong and stronger. So it's a good thing.
Medical tourism is also an element of a failed democracy. It's the failure of governance, because if our government will provide for everybody, they will also provide for themselves. Some of the ailments that they go abroad for, something like sore throat, I think that we can ordinarily provide. But because there's a problem with our system, there's a problem somewhere. Leaders have not been able to do what they're supposed to do for the mass, and then it's haunting everybody. For me, medical tourism is a way of depleting our economy. Part of the reason why we are bleeding and the economy is in recession is because of medical tourism. It's as simple as that.
If we should try as much as possible to actually equip our hospital here in Nigeria, it's going a long way in helping us to boost our economy. Because traveling abroad to go and attend to your medical issues is not really the best. Because one way or the other, it's have a negative effect on the economy. Why can't we encourage the people to stay here in Nigeria, to take good care of their health by encouraging the government of the day to actually fund most of their hospital, both the hospital, both the government hospital, and even the private hospital, so that they can be attended to here in this country.
Hello, welcome to DatelineAbuja. Well, on this segment, we'll be discussing medical tourism, the rise of medical tourism, especially in countries like ours. Well, in the studios today, we have Dr. Christopher Otabor. He is a consultant orthopedic surgeon here in Abuja. We'll be discussing medical tourism in Nigeria. Welcome to DatelineAbuja.
Thank you very much, Hauwa. Thank you for having me.
Now, why the rise of medical tourism in Nigeria? I mean, everybody travels, even for the slightest thing, especially when it comes to maternal issue. People travel out to give birth. I know surgery, if it's surgery, heart surgeries, and even bone infections, people travel out. But for you to give birth, people travel all the way, even to Dubai, to have their babies there. Not for paper's sake, but they just feel that they have better caregivers in advanced countries, even developing countries like India. Why the rise? What's the problem?
There has been a trend. In the 70s and in the 80s in Nigeria, there was hardly any major hospital in this country that you will not find an Indian doctor. Because the naira was good, solid, very competitive. So people migrated from wherever they were to come to Nigeria to work and be gainfully employed, and they were able to repatriate part of their earnings back to India specifically. But over the years, from the late 80s, when we began to experience economic hardship with the introduction of the structural adjustment program, the naira devaluated, we began to see less and less of the Indians in the country, and the trend reversed. So Nigerians now started going abroad. The economic downturn came along with consequences, and as the naira got weaker, the purchasing power of the naira also reduced. So we were not able to buy or maintain the standard of medical care as it was in the 70s and 80s, and also the population of Nigeria increased far ahead of the rate of the development of the medical infrastructure. So there has been a big gap, and then there are so many other factors that have contributed to Nigerians wanting to go abroad. For the women who want to go to give birth, studies have shown that majority of them want to go to a place where their children can be citizens, and then they get the paper so that in the future they will have access to those countries.
But now it's not, they don't even mind not getting the paper because people go to the United.
Yes, no, that's just one of the reasons. The other reason is because of the confidence of Nigerians have been degraded, especially when it comes to the assurance of good quality healthcare. I did a presentation recently at a conference, and I put the factors that contribute to medical tourism into two groups: the pull factor and the push factor. The pull factor is the things that are pulling Nigerians from Nigeria to those countries, and then the push factors are the factors that are pushing Nigerians away from Nigeria to those countries. And starting with the push factors, things like lack of equipment. Nigeria is a poor country, whether you like it or not.
But we're developing.
Despite...
We're not underdeveloped.
We are developing.
We're developing.
Yes. Whether corruption or not. Corruption just makes the poverty looks more apparent. Whether anybody steals a kobo or whether they don't steal, Nigeria is still poor. I'll give you an example. I visited a place in Canada, Alberta. Alberta is a province, like a state. They have about 4 million people. That's less than half the size of Kano State. Their healthcare budget for 1 year is $18 billion in 2012.
For 4 million people.
For 4 million people, $18 billion. If you go by the exchange rate of today, $18 billion, our total budget as a country, the federal budget, is less than $18 billion, including health, education, everything. So, and we're talking of 4 million people having healthcare budget of $18 billion. Wow. So you can see that that's why they are called developed country. So the discrepancy is much. So the tendency is for people to want to move if they have the means to those places. So there's poor health infrastructure, there's poor equipment and all that. Then lack of human resource. A study was done by Partnership for Transforming Health Systems in Nigeria. It's a British government-funded program. It was discovered that the most critical problem we have in healthcare in Nigeria is lack of human resource for health. In that study was done somewhere around 2012. In Jigawa State, for instance, we have only 67 doctors in the whole of the state, serving about 3 million people, and almost half of those doctors are in administration. So you can see that there's a critical gap in terms of human resource. For instance, the doctor-patient ratio in Nigeria is about 1 doctor to 4,500 patients. And the WHO standard is 1 doctor to 600 patients. So because there are about 35,000 doctors that are currently practicing in Nigeria with a population of about 180 million people. So you are talking of 1 doctor to 4,500 or thereabout patients. And many of the doctors are concentrated in townships. So there are local governments in this country where you don't even have 1 doctor. Sometimes
the villages, none.
Yes, sometimes you have only 1. I'm even talking of local governments, not even villages. So there's a gap in terms of human resource for health. But another thing, we have moments of brilliance, moments, centers of excellence in Nigeria where we do big things and we are globally competitive. But the information is not even going out. Okay. Because in India, they have a problem. In India, where Nigerians go to, their maternal mortality rate is so high.
But not higher than ours.
Not higher than ours, but it's 5 times the maternal mortality rate of America. It's a developing country. We have the poorest people in India.
Yes.
We have some of the worst hospitals in India too. Their patient-doctor ratio, their doctor-patient ratio is 1 to 2,000. And
so they're still better than us.
Yes, they are better than us. The WHO says 1 to 4,000. For the total number of people who need open heart surgery in India, they are not able to have up to 10% of the people treated in India. Why is this so? Why are Nigerians going to India? Nigerians are going to specific areas in India, specific hospitals that have distinguished themselves. So it's not the whole of India that is so beautiful. It's just a few hospitals that have come out to up their game and increase the standard. And we have such hospitals here. Why
don't we have such?
We have some of the hospitals here.
So is it lack of information?
Yes, lack of information. People are not aware of what is happening in Nigeria, and that's because of the laws.
So how can we say that?
In Nigeria, you are not allowed to advertise. But Indians will come here and advertise and take the patients away.
Oh, yeah.
That's the problem. If you advertise in
Nigeria... Even some Saudi and Dubai hospitals, they have their billboards scattered all over Abuja.
Thank you. They come here and they do all sorts of stuff.
PR here.
If you go to the internet, you will find all the Indian hospitals popping up, looking you in the face. But the truth is, the expertise may not be too different. Yeah, there are some good hospitals in India, like Apollo hospitals, and the Fortis and the rest. But that's not the average representation of the Indian medical system. So what we just need to do is to improve on the ambience of our hospital, because sometimes they sell the structure. Yeah, the structure looks so big and intimidating.
Packaging.
Yes, packaging. That's what we need to begin to do.
You think for the private sector also as public?
No, the public sector have failed. The government hospitals have failed. I'm talking about the private sector. The private sector, the future of tertiary healthcare.
But it's not everybody that can afford to come to. Now we're talking about medical. What of Nigerians? Now you're telling a Nigerian, please don't go to America, don't go to India to have a baby. Come here, and they can't go to a public hospital.
Now anybody who would get into the plane to go to India, America, or UK for treatment is already endowed enough to pay any bill in the private hospitals in Nigeria. So we are not talking about the masses. We are not talking about the poor. We are talking about the middle class and the rich who have the money to spend, but they will choose to go abroad. Those are the people we are addressing, because the poor ones will not enter the plane to go abroad for treatment.
They'll go to the government hospital.
Yes, they will go to the government hospital, and so because they are disadvantaged in terms of finances, whatever it is that they get, they accept it. But for those who have an alternative, they need to know that going abroad is not always the best, because maybe if time permits, we'll talk about the disadvantages.
Yes, that's what I'm coming there now.
Yeah.
But there are coming to disadvantages of traveling and advantages. I'm sure, let's do the advantages first. I'm sure there are more advantages than disadvantages.
No, I don't agree with you.
Can you give me 5 each? 5 advantages, 5 disadvantages?
No, the advantage of traveling is that if you do your...
So it's a developed country.
Yes. The advantage of traveling anywhere, because the reason anybody would want to travel is the thinking that you get better treatment and you go to a better facility.
So they are more developed.
Yes. So the advantage that we can think of is that you get better treatment. The outcome of treatment will be better. But that has not even been put to scrutiny, and there are many disadvantages. We've had.
Sorry, give me one advantage.
The advantage is what I've said. What else? There's nothing except maybe
not better health care.
No, that's at the end of the day.
Better care after post treatment, pre and post.
At the end of the day, outcome envelopes everything. Better outcome of treatment. Okay, but the disadvantage, and that's perceived, because there are many patients who go to India as live people and their bodies are brought back as corpses. Yeah. There are people who travel to India, they get, or to other countries, they have good surgeries. But on arrival at the airport or here, they fall and die because of a particular condition called deep vein thrombosis. When you undergo surgery, the viscosity of the blood is high within the first 6 weeks or thereabout. If you now undergo a flight, the risk of the blood clotting in the vein is higher.
Oh, and a long journey.
Yes,
flight.
yes,
Okay.
long flight. So if blood clots in the veins, it can just come up to the lungs. If it blocks the lungs or the heart, that's instant deep vein thrombosis.
So, but to avoid that, it means that after surgery,
You may have to stay
there
longer.
for 3 months.
Yes, you have to stay longer, and that means more finances. I mean, what about people who are busy? What are you going to be doing there? Then also, in terms of mismanagement, which is a very common thing, especially in those developing countries too, mismanagement is covered up. And
How so?
yeah, it's if a mistake is made, you know, you are in a strange place. Colleagues would try to cover up everything and give it a name, and you go with it. And then should it become obvious that you have been mismanaged, you can't fight for justice easily, because the laws that operate for foreigners is different from the laws that operate for the indigenous. So that's another advantage. Then another one is cost, which is very critical. There's a patient of mine that went to do knee replacement surgery in Israel. She paid $35,000. That's almost like 14 million naira now, with the dollar of about 400. I do knee replacement surgery for now, even with the dollar increase, with 1.6 million.
Wow.
Yes, and she pays $14 million. And you know the sad story.
14 million naira.
It's 14 million naira. You know the sad story. The knee got infected. She had a complication. She came to me.
So she came back.
Yes,
home.
she came back, and you know she had 2. They did one for $35,000. Transport cost not included.
Accommodation and
Yes,
and
not
all that.
included. This is just cost of surgery. And now that one was, I had to treat the one that was done in Israel. And then she was like, oh, I didn't know you could do this good. I'll come back for the second one here. Wow. You know, but why go through all that? All that. It's not necessary. So cost is a factor, especially with the naira depreciated. It's a major factor among the disadvantages of medical tourism. Yes.
Thank you so much. It's been very informative and educative.
Thank you.
And we hope that this discussion actually decreases medical tourism and helps promote medical tourism or medical experts.
Reverse
medical tourism, yeah. With our current economic recession, it's time for Nigerians to look inwards by supporting and developing our local industries. From the feedback we had on the streets, we've realized that Nigerians have lack of faith in our medical sector. Instead of spending those monies abroad, why don't we bring them back home to develop our local industries? We can bring in experts to train our medical health workers or anybody that needs to be trained to give us better services and an excellent performance. Till I come your way, same time, same station, I'm Hauwa Momoh. Bye for now.